UK's National Health Service, or the NHS, is bracing for the most disruptive walkout as junior doctors across England are expected to stage a 4-day strike. More than 250,000 appointments and operations are expected to be cancelled, with some hospitals reporting that almost half of all the planned treatments are likely to get disrupted. According to the NHS estimates, between 250,000 to 350,000 appointments and operations are likely to be cancelled. However, the union said doctors will report back to duty if lives are at risk. The junior doctors' approach is diametrically opposite to recent strikes by nurses and doctors, as they exempted certain emergency services. The Health Secretary, Steve Barclay, accused unions of timing the strike just after the Easter weekend, as many hospitals are expected to see a surge in demand.
The morale is at an all-time low. I don't remember the last time I went home and felt like I've done a wonderful job, everyone's got the care they wanted, the care they deserved. I don't remember a time I've gone off shift and felt like I had energy for anything left. We're just all running on empty, emotionally, physically. It's a dire situation.
And last month, a 72-hour strike by junior doctors led to more than 175,000 patient appointments and procedures being cancelled in England. Junior doctors represent nearly half of the medical workforce in the UK. And Alex is now joining us live from London for the very latest on this. Alex, well, what are the key demands really of these junior doctors as they go on massive strikes?
So the demands are that they're asking for this 35% pay rise. That is taking into line inflation over the past decade, not just this recent high inflation. They say that over the last couple of years that their pay has not been in line with inflation, and they are now wanting that pay restoration back. So even though it does sound like a high number compared to the nurses who wanted 7% and the rail unions who also wanted about that percentage as well, it does look like it wants to be backdated and they want to get the pay restoration, but they also want it to come with no extra demands on them having to do zero contract hours or work overtime when their mental and physical health is suffering. Right now, a lot of the doctors here in South London, they have been striking, and across all of England they will be striking up to the next 4 days, but they are still asking the government to come to the table. The British Medical Association said today that they are still willing to negotiate, but speaking only earlier, Health Secretary Steve Barclay said that 35% is unreasonable and he won't come to the table to discuss pay until at least the BMA calls off these strikes, because ultimately it's affecting patients. And he says, Steve Barclay said that he called the junior doctor strike militant, and he also said he still believes that's the case.
Right. And Alex, of course, the obvious question then also is, what sort of impact will this have on the NHS?
The NHS has been crumbling for the past couple of years, and we heard there from some of those junior doctors that this was just them pushing that last extra to try and get some kind of resemblance of the NHS of old. But ultimately, NHS workers, nurses, ambulance workers, junior doctors, they're all saying the same thing, that it's just too much pressure and they're being asked to do things that they didn't sign up for. They want to look after patients, but that does seem to be not happening as often as they'd like, or they'd be working over and above the hours that they should be. So they're causing extreme stress, therefore they're leaving early or finding other jobs. And of course that's then going to put patients at risk. NHS had said earlier today that they do believe that patients will be at risk today, because after a 4-day weekend there has been a lack of staff already, and then this extra strike will push them to the very limit, despite the fact that there are contingency plans put in place. But the British Medical Association has retorted back to that, saying that patients' lives have been in risks for the last couple of years because operations have been cancelled during COVID, and they are still being pushed back, and people aren't getting able to see their GPs or any medical professions. So there is a lot of a back and forth between the unions. But the new survey from Ipsos has suggested that people are still backing junior doctors. They are still backing the NHS, and they do want a resolution quickly, and they do seem to want it in the NHS's favour.
Right, Alex, thanks very much indeed for joining us with the very latest there on that strike by junior doctors in the UK, putting a lot of patients there, well, at risk as well. But of course, everybody wants a mutual resolution to that. Thanks for that.